Hi there. This is Dr. John Whitcomb talking about your oral microbiome and exercise capacity. I bet you never thought there was such an association, but it's a relatively strong one. And here's how it works. You have some 700 different bacteria and viruses that are exclusive to the biome of your tongue. But there are actually only 4 critical ones that are involved in making nitric oxide. When you eat vegetables, the natural nitrates in vegetables show up on your saliva in about 90 minutes and get concentrated tenfold in your saliva. Those nitrates, when you salivate, are then exposed to the biome of your bacteria on your tongue, and they get turned into nitrites. You swallow that saliva, and nitrites in your stomach, if the pH is less than 3, will get converted to nitric oxide that has systemic applications in effect. The nitric oxide is a gas, so it's very evanescent, and it's very hard to measure. But we now know that nitric oxide doubles the penetration of oxygen in your tissue, plays a huge role in helping hemoglobin transport oxygen. And so your capacity to exercise is entirely dependent on the health of your nitric oxide system. Well, guess what happens when you use chlorhexidine-containing mouthwash? Correct. Within 2 weeks, if I take 20 dental students and give them mouthwash twice a day, I can raise their blood pressure 10 points or so. In just 2 weeks, young people blood pressure going up 10 points. That is the effect of nitric oxide disappearing because the mouthwash kills off the bacteria and they lose their nitric oxide. So, exercise capacity? Yep, it depends on your nitric oxide. Nitric oxide depends on not using mouthwash. What will work for me? When I read that, I thought, okay, I threw out my mouthwash. I floss, I water pick, I brush, no mouthwash. And all those PPIs, Prilosec and company, if you're taking something to neutralize your GERD or help your stomach acid, you're instantly losing nitric oxide. And that is why within 3 months of using those long-term PPIs, you can show increased risk of cardiovascular disease. You want your nitric oxide, but the biome on your tongue is precious and it needs to be cared for. Stop the mouthwash. Here's Dr. John Whitcomb for News and Nutrition. Mouth biome predicts exercise capacity. Wouldn't have expected that.